people are concussed, first thing we have to do is go through a diagnostic pattern, right? We look at them, I do an examination, we put them through the testing so we can see where they are. Then when we review that test, we'll come up with the things that didn't go well. We measure eye speed, we measure balance, we measure all the different things that we measure. Sometimes what we'll do, it'll be as simple as, okay, how do we get this area to be quiet and this area to go faster? This area has cranial nerve 6 in it and is more likely involved in a no-no movement of your eyes. The upper area, the mesencephalon or the midbrain, has cranial nerve 3 almost exclusively when it comes to eye movements. So bringing your head up and down and controlling those eye movements. Sometimes it's that simple. Sometimes we'll have different little eye movements, we'll have different targets going different ways, but it's largely rehabilitation in the eyes. We'll also use vibration. Why vibration? Because vibration speaks very quickly to the big brain. Quick stretches speak to the big brain and the cerebellum. Sometimes we'll use cerebellar activities. How do we get you better? Well, you can't see anything down in this target, okay? We're going to tip your head so that your eyes are driven down that way, and then we're going to load this quadrant so you have to go down here more. Rehabilitation is the way to treat these kinds of things. And the question is therefore big, how is your brain doing? Right? Well, I wasn't concussed, so I'm fine. Really? Do you know that? I mean, how many people have had a blood test in here? Some people have never had a blood test. How do they know what they're doing? Some people have never had their brain test. How do you know how you're doing? Right? So that's what we do. We identify the area that's not working very well via reflex or via testing. Then we set to work giving more feedback to those things.